1 in 8 women will develop breast cancer over the course of her lifetime. Each year, countless events, walks, races, and fundraisers are held to increase awareness around breast cancer. And among the sea of pink shirts are men, usually there to support the women in their lives. But breast cancer is not just a woman's disease. Around 2,500 men are diagnosed annually.
So I had heard about it and knew it was possible, but I had never really known anybody, so this was a first for me.
In January 2018, Dave Wiggum became one of them.
I was in the shower one morning and felt a little something on the side of my nipple. I remember when I first talked to my doctor about it, and he said, well, it's probably nothing, let's get it looked at, and so they did. And finally the day came where they called me to tell me what the results of the biopsy were, and they said, actually, David, you do have cancer.
In my professional career, and I've been in medicine for about 20 years now, I only have about 10 patients with male breast cancers with extremely rare disease.
Mayo Clinic oncologist Dr. Saranya Chumsry was part of an all-female team of breast experts, radiologists, and surgeons who treated Dave.
There was the question on the table of would I have a full or a partial mastectomy.
Because it's so rare, unfortunately we do not have a randomized controlled trial data on how to really treat male breast cancer. There's not a whole lot of data out there. So we normally treat male breast cancer similar to female breast cancer.
After having a lumpectomy in February of 2018, Dave underwent daily radiation and several rounds of chemotherapy. Now he hopes to make a difference in the care of men with the disease by participating in research studies.
Because somebody did it for me and I want to pay that forward and do it for someone else. I also wanted to make sure that more men got captured in the data so that if there's any kind of difference or if it's exactly the same, that they'll feel a little more comfortable about how rounded the data is.
A self-described private person, Dave didn't talk about his diagnosis or treatment with many at first.
I got tired of running down the hall to a conference room to talk to the doctor, so I just took the call right at my desk. And afterwards, this lady who works with me came over and she said, Dave, I didn't mean to listen in on your conversation, but I heard it, and I just want you to know you don't have to do this alone. And I said, well, thanks, I appreciate that. And that really changed things for me because I decided to tell everybody.
Dave says he got lucky by catching his cancer early, when it's highly treatable, and he has this message for other men.
I would encourage men to talk about it, to be open about giving themselves exams. Do that to give yourself the best chance to find something that might be there. I never felt funny about having breast cancer, but I feel really good about being someone who can spread the word that this happens to men too, and so that you need to be doing things to keep yourself safe.
For the Mayo Clinic News Network, I'm Joel Streed.